Morning everybody, I am Sagari. Today I am going to discuss median nerve in the hand part. First of all, I would like to ask you a question. Does anybody know what are the other names of median nerve? Anybody? Leberous nerve, yeah. Reason for it? Okay, it's called laborous nerve because laborers usually perform actions such as digging and lifting heavy objects, and these actions are performed by the flexor muscles of the front of forearm. So this flexor muscles of front of forearm is supplied by the median nerve mainly. So the median nerve is called the laborous nerve. It has one more name. I'll give you a guess. It is for the hand part. Any guesses?
Why is called as IO? No, I don't.
Yeah. What is the other name for median nerve in the hand part?
Eye of palm.
Very nice. Yeah, it is called eye of hand or the peripheral eye. Does it mean that it can see things? No. It is because it can sense things. Even by closing your eyes and touching an object, you can sense things. You can feel the texture and thinness of the object. Example is the cloth. If you just touch the cloth, you can feel the thinness and texture of the object. And it also allows or permits certain fine movements. Like you can buttoning of your coat. You can just do it by your thumb and the index finger. So there is sensory innervation of the median nerve to the pulp of the thumb and the index finger. Hence it is called the eye of hand or the peripheral eye. Now moving on to the main topic, I'll just summarize what Shubhya thought. It arises from the brachial plexus, here, forms a Y-shaped structure forming the median nerve, then runs along the brachial artery. First it is lateral, then crosses it and then becomes medial. Then it goes to the cubital fossa, where again it will be medial to the brachial artery and the tendons of biceps. Then leaves the cubital fossa to enter the forearm part. Here it will move between the two heads of pronator teres. Here it will become branches, supplies the four superficial flexor muscles here, and branches out into anterior interosseous nerve to supply 2.5 muscles in the deeper part of the flexor compartment of front of forearm. Next, here you can see that the median nerve will be deeper to all the flexor muscles, but as it comes towards the wrist, it becomes superficial. That is, the median nerve will run in the lateral border of the flexor digitorum superficialis and becomes superficial here. There it becomes a branch called the palmar cutaneous branch. See here, you can see it properly. This is the palmar cutaneous branch arising from the median nerve. It goes superficially to the flexor retinaculum and reaches the palm, where it supplies the skin of the thenar eminence and the lateral part of the palm, lateral 2/3 part of the palm, like this. And the next one is the median nerve, which is the main branch here, along with the 9 tendons. Can anybody name the 9 tendons over here, which is passing through the carpal tunnel? 9 tendons. 4 are from the flexor digitorum superficialis, 4 are from the flexor digitorum profundus, and the last one is the flexor pollicis longus. These are the 9 tendons. Along with the median nerve, it will go through the carpal tunnel. There may be some injuries also here. If the median nerve is compressed, it causes carpal tunnel syndrome. This median nerve, when it enters the palmar aspect, here it will divide into lateral branch and the median branch. In the lateral branch, it forms the recurrent nerve here. This is the recurrent branch of the medial nerve. This will be supplying the thenar muscles. Somebody please tell me what are the thenar muscles? Here. Abductor pollicis brevis, flexor pollicis brevis, and the opponens pollicis. So yeah, this recurrent branch will be supplying the thenar muscles, and there are 3 proper palmar branches over here. 1, 2, 3. 2 will be supplying the thumb, and 1 will be supplying the lateral part of the index finger here. And the medial branch will be forming 2 common palmar branches. First common branch is pair is, one will be going to the medial aspect of the index finger, and the lateral one, and the other one will be going to the lateral part of the middle finger. The second palmar branches will go to the medial part of the middle finger and the lateral part of the ring finger. This is how it branches. You can see here there is, for this palmar branch, there will be a small twig-like structure. This will be supplying the first lumbrical muscle, this one. And for the common branch also, here another small twig will be there, that will be supplying the second lumbrical muscle. So overall you can tell that it will have sensory distribution and the motor distribution. Sensory distribution is to the skin and the skin of thenar eminence, skin and the lateral 3.5 digits, whereas the motor distribution is to the lumbricals and the thenar muscles. Here also a structure figure is there overall. This median nerve not only supplies the palmar aspect, it also supplies the dorsal aspect. In the dorsal aspect, it's only for the nail beds and the distal phalanges. Here again there is an overview for recalling. Here, these are the small twigs, it's more clear here. To the lumbrical muscle, one from the common palmar branch, this is the proper palmar branch. This is the shaded part of the median nerve. Other than the motor branch and the sensory branch, there is another branch of median nerve. That is the connective branch, which connects the median nerve to the ulnar nerve in the palmar surface. This one. So this is a summary slide in which you can see all the motor branches of the median nerve in the forearm. This is superficial, this is deep from the anterior interosseous nerve, and this is to the palmar surface. In the palmar surface, you can tell motor branches as a mnemonic is loaf. Loaf means lateral to lumbrical muscle. O is for opponens pollicis, A is for abductor pollicis brevis, and F is for flexor pollicis brevis. This is the sensory branch supplying the lateral 3.5 digits. So there may be some injuries to the nerve, that is the median nerve. I have already said that here the median nerve will become very superficial. So if people who are doing suicidal attempts, we should not do, but when someone is doing suicidal attempts, there will be cut to the median nerve, which through which there is loss of sensation to the lateral 3.5 digits, and it causes loss of sensation in the palm. Here, aptherm deformity is a clinical feature for this, where superficial median nerve will be cut. That time what happens is, this here, the thenar muscle will become paralyzed. So, the thumb cannot be abducted nor opposed. This is what happens in aptherm deformity. This is a clinical case study. There is a female who is of 50 years. She is suffering from rheumatoid arthritis. She feels pains and pins and needle sensation in the lateral 2/3 of the palm, this one, and the lateral 3.5 digits. It increases during night mainly. When she did examinations, they told that there is wasting of thenar eminence, hypothesis, loss of sensation, and there is cuff compression test showed positive. This cuff compression test is giving compression over here for 30 seconds. Then if the patient shows some symptoms, if there is increase of pain for the person, then there is some problem in the carpal tunnel. This is the case. I'll give. Name the clinical condition on the basis of signs and symptoms. Yeah, it's carpal tunnel syndrome. What are the boundaries of carpal tunnel? Anterior and posterior. Anteriorly by flexor retinaculum and posteriorly by carpal bones. What are its contents? contains a median nerve and the tendons also, 9 tendons. Compression of which nerve leads to this condition? So why is the pain increasing for that person during night? No. It's because during night tissue fluids start accumulating in the carpal tunnel because there is no pumping action, because the arm will be completely at rest during night. So there will be accumulation of tissue fluid. Pain increases during night for her. This is what happens. See, this is the median nerve which is getting compressed, and this is the area. Actually, I have a question here. When there is compression in median nerve, the skin of thenar eminence can be spared from injury. Any reason why? Yeah, because median nerve will have a palmar cutaneous branch. This palmar cutaneous branch will be supplying the skin of the thenar eminence here. So it can be spared. Other parts will get injured, obviously. That's it for the presentation. Any questions?
It was awesome, not bad. Actually, really good.
Thank you.
Case was very good. Explanation to the case was okay. Job. So much.